For my disease project, I chose carpal tunnel syndrome. I chose this disease because when I was growing up, my mom had a severe case of it and made it to where she couldn't work, sleep, and it really disrupted her life because she was in so much pain and she wasn't able to fully control her hands. So, the first thing that I would like to do is break apart carpal tunnel syndrome into its terminology to get the definition. When we look at the word carpal, it stems from the root word carpo, which means wrist. Then it combines with a suffix to build the carpal, meaning pertaining to the wrist. Next, we see tunnel, which refers to the narrow passageway that is formed by the bones and ligaments. And finally, we have syndrome, which refers to a group of symptoms which consistently occur together or a condition characterized by a set of associated symptoms. When we put this together, we get the definition, which is a condition associated with symptoms of the carpal tunnel or wrist. And we will cover what these symptoms are and the treatments for this condition after we look at some of the anatomy behind CTS. Let's first take a look at the wrist. As we learned back in the skeletal system, the hand is made up of the carpals, metacarpals, and phalanges. We can see this in the diagram, and then I pulled this video from Experienced Anatomy, an anatomy education provider that uses real specimens to give a better understanding of what these bones look like.
Well, here are the carpals right here. The carpals are what allow us to bend our wrist like such. And the carpal tunnel is actually right here. I'm sticking my finger under it. And the carpal tunnel is this tough ligamentous tissue that forms a bridge over the tendons and the median nerve that pass from the forearm into the hand to hold them against the joint.
So she mentioned the median nerve. So let's take a closer look at that since it's one of the main contributing factors to CTS. We can see here that the median nerve is coming off the brachial plexus, which, as we learned in the nervous system, is a network of nerves that sends signals from the spine to other parts of the body and allows us to move and feel some sensations. Then the median nerve travels from the brachial plexus down and under the clavicle, as we can see here. Then the median nerve travels down the arm and passes under the transverse carpal ligament, which is this white bridge-looking structure on the wrist in the model. All along the way, this nerve is innervating muscles for motor movement. Once this nerve passes under the ligament, it splits into two branches, the recurrent branch and the common palmar digital branches. In this image on the right, the yellow arrow is pointing to the median nerve, and the transverse carpal ligament has been faded to allow you to see it. If you follow this nerve, which is in yellow, distally, we can see the split. The recurrent branch innervates the thenar muscles, which is a group of 3 short muscles at the base of the thumb, and they are responsible for precise thumb movements. Then the other split of the median nerve is the common palmar digital branches, which supply the lateral to lumbal of the hand. The lumbal muscles are responsible for the flexation of the metacarpophalangeal joints and extend the interphalangeal joints. The common palmar digital branches then further divide into the proper palmar digital nerves, which, as we can see here, innervate the pointer, middle, and half of the ring finger. On the right here, the C, G, E, and I photos are of a real hand, and the median nerve is being pointed to. And in this image, you can really see how the almost tree-like structure of this branch is, and really how thick this median nerve is. This next photo is just to give you a little bit more of an understanding as to what sensory distributions we're getting from this median nerve. So we can see the half of the palm is getting innervated, the thumb, the pointer, middle, and half of the ring finger. The different shading is just which branch of the nerve is innervating what, like we covered in the previous slide. So back in the 1913, a couple of scientists named Marie and Charles Fox were the first to notice a relationship between the compression of the median nerve and the carpal ligament pathology. So this compression means the act of constricting, enough to where the nerve impulses struggle to pass. And now we're getting into a little bit more of the syndrome and how it happens. When these portions of the hand are swelling, the median nerve really takes the brunt of that swell, and this compression of the median nerve makes it to where these nerve impulses are harder to get through this tunnel. Because these impulses have a hard time reaching their target, it causes numbness, tingling, pain, and troubles with dexterity. And twitching of the hand muscles are also a sign of CTS. This is a short video showing these muscle twitches. Carpal tunnel syndrome is also usually in both hands. Now, who usually gets carpal tunnel syndrome? Everyone can get it. But it's most common in older adults, people who have heavy physical jobs, like working with jackhammers. Smokers can also get it, women who are pregnant because the hormones brought on by the pregnancy, but usually these symptoms improve as the pregnancy ends. Also, people with thyroid disorders or repetitive movements can cause carpal tunnel syndrome. A study from the National Library of Medicine, the world's largest medical library located in New York, published a study over the effects of excess body fat on carpal tunnel syndrome. This states that after 58 studies consisting of over 1 million individuals, the results were that being overweight or obese will increase the risk for carpal tunnel syndrome. The associations didn't matter between men and women as well. So we learned about how carpal tunnel happens and what the symptoms are. Now let's take a look at the treatments. So the first best treatment for carpal tunnel syndrome are splints that keep your wrists straight. Mainly wearing these splints at night, but not all day because we don't want those muscles to atrophy from not being used. The splint can really help with acute pain, so if somebody was having mild to moderate pain, it can really help settle that. According to Dr. Haverstock, a medical doctor who specializes in the shoulders, he recommends that people should wear the splint for about 3 months, and that it's still possible for after that 3-month period that if someone stops wearing the splint, CTS can come back. Next for treatment, we have physical therapy, which can help with nerve gliding exercises. And then there are both medications and injections used to treat carpal tunnel syndrome. Usually these medications are anti-inflammatories like corticosteroids. Lastly, for treatments, we have surgery. The surgery for carpal tunnel syndrome can be single or double portal endoscopic carpal tunnel release surgery. What is usually done during the surgery is a local anesthetic is administered, although sometimes general anesthetic can also be administered, just depending on the case. During this surgery, it's mainly to free up space in that tunnel, usually by cutting the ligament, and the nerve usually isn't messed with. The surgery is very quick too. It's about 15 minutes. Then the palm and wrist area gets stitched up. So as we discussed, carpal tunnel syndrome is a condition where the median nerve is compressed. We went over the causes such as having labor-intensive jobs, pregnancy, and repetitive hand movements. And then we went over some treatments like wearing a splint physical therapy, and medications. And these are just my sources. Thanks for listening.